Welcome, and thank you for joining this program, 5 Secrets to Retentive and Efficient Crown Preps. My name is Dr. Lori Trost, and I will be presenting this program. Just a little bit about me. I practice restorative dentistry in the greater St. Louis, Missouri area. Above all, I profess to be a lifelong learner. I'd like to take this opportunity to thank those responsible for this program, Premier Dental Products, and the Viva Learning Platform. I would also like to disclose that although I have no personal financial interest in any of these products, I am receiving an honorarium for this program. All the procedures and products used in this program are supported by the literature and used in my practice. If you have any questions during the program, please type them in the questions box that you can find below the screen, and I'll be happy to answer them at the conclusion of the program. With that said, I consider this a privilege to share time with you, so thank you for being here. You know, this is a really relevant topic, and I think all of us as clinicians are so curious about how we can learn ways to be better dentists, to provide better products for our dentists and for our patients. And as dentists, I think we grab onto the idea that little bits here, little tidbits, no matter how long you've been practicing, it could be a few months, it could be maybe 7 years, it could be 2 decades, 3 decades. No matter what, I think there's always new learning out there, and dentistry is such a great changing profession, evolving profession. So a lot of what you're going to see tonight today is about products and how they are really helping us provide wonderfully aesthetic restorations. But the undercarriage of that has to be a good preparation. So it has to be efficient. It has to be a retentive preparation. So we're going to talk about a lot of good basics here that really move those forward with what the changes and the evolution of some of these dental materials have provided for us and what they demand of us as clinicians. So I think it's kind of a neat topic. So bottom line, prepping a crown with a burr spinning at really high speed in a handpiece of over 400,000 RPMs, I think that we would all agree is really a pretty daunting task. And aside the patient challenges, you know, often we have curious tongues. Patients might have a tight cheek. We have a difficult job to do. We're trying to reduce tooth structure. We're trying to do it carefully, conservatively, and you know, think about refining a margin and just the detail that's involved here with preps. They're tough, and I think we need to acknowledge that. So anything I think we can do to make that a little bit easier is really worthy of a discussion. And the truth be known, as dentist myself, I struggle often with prepping. You know, you have patients that have a lot of saliva. You've got patients that have no saliva. Again, it's a routine process that all of us do, and Crown and Bridge, it really is the bread and butter of many, many dental practices. And what we're doing and what we're talking about here is done routinely. So the more and more we learn about it, I think it's better. What's interesting today, too, as more and more ceramic restorations are being fabricated, as clinicians, we've got to be aware of what all these material changes are and the distinctions as well as the depth specifications so that our lab tech doesn't call us or ceramist calls us and says, hey, there wasn't really enough room or enough reduction or the margin really is in question here. So again, these are some topics and discussion points we're going to hit tonight or today. You know, the funny thing is, as dentists, so do we really understand how to properly use a burr? Do we understand what the burr can do for us, what it can do for the prep? Do you realize that you use 20% of your diamond burrs for 80% of your preparation design? So it's about that 80-20, that Pareto principle rule. Really interesting. How do we get the most benefit from the burr design? And then do you know that you can really use the burr to be a measuring tool as well? So we'll talk a little bit about that. Do you ever ask yourself, can I reuse that diamond burr? Do you even know when the efficacy of the diamond burr is no longer? How about the quality? So really, we really need to develop a more straightforward approach when we're prepping teeth that's really predictable and that we are certain the effectiveness of that burr is really helping us in doing the right thing for our patients as well. So it's about working smarter and not harder. We don't want to have hand fatigue. We don't want to have eye fatigue. We want to be able to do the process quickly and simply. So what we're going to really talk about right now are retentive prep characteristics and identify what those are. We're going to adopt a very methodical tooth reduction approach. And I'm going to go through that step by step and show you how I approach teeth and how I reduce them and what methods and how I look at things and just kind of give you some insight on that a little bit. And I do want to review, like I talked about earlier, the ceramic materials that are on the market today and what their specifications call for. And finally, I want to talk a lot about how to maximize the benefits of each of the burrs that we can select in our toolkit. And I really want this program to be about practical tips in prepping teeth to make them very efficient for you, so that you can take this knowledge with you tomorrow to your practice and really be able to use it conveniently and easily. Before we get too far along, though, I do want to identify some pitfalls, and here's a short list of where things can really fall short of just being better than what we can do better than what sometimes it's just a tough thing what we do with preparations. And lack reduction, I know, is probably the #1 pitfall that many of us have incurred. And so I'll talk a little bit about some tips on how we can work with that. Improper reduction, sometimes we take away too much tooth structure. So again, this goes back to retention resistance form. We'll talk a little bit about that. Also, lack of defined margins. And again, this is not really something that you just understand one day. It's something that you have to really practice, you have to really hone, you have to really feel with your hands, have the burr work with you in a good handpiece. But you've definitely got to understand that not having well-defined margins really set yourself up for when you take that final impression or that scan, that digital scan, it's going to be trouble, and that ultimately that final restoration will be affected with that. Undercuts, again, are another pitfall, and of course diminished water spray, not using enough water, and we'll talk at length again about that as well, because that's very, very, very important. So basically, solid restorative dentistry requires a retentive preparation design. The taper should ideally range here about 8 to 12 degrees, like you can see, and ideally the coronal height should be somewhere in the neighborhood of about 3 to 4 millimeters. I do want to emphasize that retentive tooth buildups and parallel tooth preparations are really mandatory for optimum long-term success for any type of restoration. So again, we need to really work to have a preparation that has the proper height, and this might mean that you might have to back up a little bit, do a crown lengthening. You might have to do a buildup. You might have to alter. Maybe occlusion is you can't get the parallel nature that you need for the adjacent teeth with the draw. So again, you've really got to look at what is around that tooth preparation, the height of it, look at the gingival structures, the periodontium. There's a lot to consider when you look at retentive preps. We just can't dive in and start prepping a tooth and thinking it's going to work all the time. You know, another thing is when you're looking at non-retentive preparations, it's quick and easy to say, oh my goodness, yeah, it's short, the height is short. So again, smaller height, greater taper leads to less retention. And you can see here how when a preparation is over tapered, you're going to have less resistance form. You're going to have just the ability of that final restoration not to be really well suited for that preparation. And the preparation is not well suited for a long-term restoration. So it does become an issue. And we've got to understand, we've got to develop a better method in which we have preps that have retention, that have the proper build-up form, that have the proper height and the proper width. So really commit to these principles, and I think you're going to have better products for your patients ultimately. Going into this, we have to come to believe that when you're prepping a tooth, we have all the need for speed in the world. We have great high-speed handpieces now that we use, but when you look closer, what happens to a burr, it's really an important factor. The very basic information should be used as how we select rotary instruments. Bottom line is, as the speed occurs on the burr, and it rises in a higher RPM nature, loss of particles happen on the burrs, and the burrs can change shapes. Because of that, this damage, and it's a considerable amount of damage that happens on the burrs. A lot of this is really naked to, it's not visible to our eye, our eyes, our naked eye, and it's very damaging for the cutting quality, and the efficiency changes, and therefore your quality of your preparation is going to be in question, and more importantly, the cost is going to be greater because you're going to go through more burrs. A lot of times I know that in my own practical experience, I've pushed burrs where, I kept thinking I can get by with this, and bottom line is the quality was just not there. The burr, the cutting effectiveness was not there, and as a result, I probably overheat, and I have overheated teeth. I'm sure I have, and I have learned a lot from that, and I've learned now about more quality. So when you buy better products that really maintain their nature of their fabrication, you have a much better chance to have a much better quality, much more effective cutting ability, much better product for your patients. And ultimately, again, that reflects on our hand fatigue. It reflects on the nature of the torque with our hand pieces. There's a lot of other factors that go into this equation as well. But the cycle of efficiency on burrs is really important. So we all agree, speed is great, but the problem is the wear and tear on the burrs really can make the quality decrease and the cost go up. And I know that we're all very cost conscious today, and we need to look at this and really get the most bang for a buck, and I really want to help show that as well. I'm sure you heard the old adage, measure twice, cut once, but it's really true in dentistry. And I want to start off with talking about with preps. You need to use the diamond burrs to your advantage. You need to learn the burr dimensions and apply that dimension to how you prep. Now you only have you not only have a cutting tool now, but you also have a measuring device as well. This creates so much more predictability, and it also reduces the amount of how many times that you need to change out the burr during the procedure. So one of the first things I'm going to challenge you is get out your little ruler, your measuring stick, your gauge, and really measure the depth of your burrs so that you can relate that to when you're starting to prep teeth, how you take that forward. I think that's really critical. First and foremost, when we have a methodical approach, you want to reduce the occlusal surface first. And it starts with depth reduction. And here you can see just basic round burr, diamond burr here. And I'm going to go ahead and I'm going to achieve a 1.5 millimeter depth cuts. And I like to follow the anatomy across the occlusal table, and then I'll go ahead and start to extrapolate those out with a straight burr. But again, most ceramics are going to require about 1.5 to 2 millimeters of occlusal reduction, and you need to have some kind of measurement. So again, use your burr as a gauge and correspond that diameter then to the depth. Go ahead and then remove your occlusal table reduction and reestablish that, and you've got now your measured appropriate reduction. Really critical. I think you would talk to most dentists, you talk to most, which is a very large, we all agree it's a big challenge, but also ceramists and lab technicians will tell you occlusal reduction is something they do not see adequately done and performed. So we've got to be better at that. So use your burr as a measuring gauge as well as a cutting tool. So here we are, we're establishing the occlusal table, and you can see in this photograph on the left, you've got a molar that now has the reduction appropriately matched for the 1.5 to 2 millimeter appropriate reduction for the ceramics that's going to be placed on that in the future here. And again, I've just noted a graph here just to give you again the depth of what most restorations call for now. Occlusally, again, 1.5 to 2 millimeters. That's a really critical number here. These are just basic guidelines for metal, ceramic, or also zirconia-based restorations. I'll tell you right now, like I said, many lab technicians will tell you these are often ignored, and it's a big challenge. And as clinicians, we really just can't push the limits or sacrifice the properties of these materials by overlooking these basics. So again, use your tool as a measuring gauge as well as a cutting device. Next, I want you to remove the guesswork. And historically, like we said, insufficient reduction has really been very, very common. And I think that we need to remove the guesswork. So using some of these gauges, and some of these are out in the market today. PrepSure is one. I recently used that. It's out by Contact EZ. It's a nice little gadget. There's different sizes that come with these. Usually they're offered in a 1.5, actually a 1 or 1.5 or a 2 millimeter, and you can rotate these not only through the occlusal but also the axial or the interproximal spaces as well. The occlusal reduction ring is another nice little gadget. Again, these can be sterilized, cold sterile, and they work very well. Again, the color coded to identify the sizing for what you're going to be doing. FlexTab is another one. I've used that as well. So those are independent, solo, individually wrapped Again, gauges that you can place on the occlusal table, they're a little bit more difficult in my estimation, only because sometimes you have the idea that you can place that and pull that through. You really can't. You're really gauging where the occlusal table is going to interact with the opposing dentition. So they're a little bit harder, I think, but I really like this PrepSure. I think it's a winner, and I like the occlusal ring as well, too. So these are neat little gadgets to use and bring into your toolkit to really just confirm what your depth is and that you're appropriately reducing and conservatively reducing tooth structure. Next, when you're going to break contact, I like to use a flame-shaped diamond. These diamonds are thin, obviously, at the tip, and they help to open up the contact while protecting the adjacent teeth. Most ceramics require 0.5 to 1.5 millimeters of axial reduction. And a little trick that I've learned over time, I like to position either a wedge guard or a matrix band in the adjacent interproximal surface so that it could, bottom line, saves me the headache of having to smooth or adjust a surface that I might nick. Especially, I have a lot of patients who've had gold work, and nothing worse than trying to polish a beautifully stunning gold crown and either ceramics next door. I mean, it's just really tough. So save yourself some headache and hassle when you're going to break the contact. Use a nice flame-shaped burr, but place a wedge guard in there or a matrix band, and that will reduce your headache a little bit, and you'll be able to move on without having to drop back again, polish or adjust. When you're looking at facial and buccal reduction, again, rely on the depth cuts. And you can see here I'm using a round burr to go ahead and on the facial aspect. A lot of times I also will use a modified shoulder, which is just a flat burr, as you can see on the lower left in that picture, but I'll use one of those two depending on what I have available. And sometimes I move initially from my occlusal cuts. I'll break the contact with a flame shape. I'll go back now either to the round burr or the modified shoulder, just depending what I grab, and I'm ready to make those cuts to know that I have the proper amount of reduction. Super important to know that. And I always eye up also the emergence profile, and I gauge the opposing teeth, and I also consider excursions when I'm going ahead and doing these depth cuts as well. So I place the depth cuts, I know how much I've reduced, and then I start to gauge emergence profile, adjacent teeth, and how things are starting to line up, as well as, like I said, those excursions. Defining the margin is really amazingly so important, but it seems simple, but it's not. And once the tooth has basically been uniformly reduced, now it's time for the margin. And I find the best way to create a very well-defined margin is to move around the tooth in a counterclockwise manner. The burr is going to be spinning in a clockwise manner, and so then you're going to be taking it and moving counterclockwise. I find that you're able to better control the handpiece in the burr, and you can have a better sense and the feel for the margin. So I really like to sink my burr into the tooth, and really with, say, a modified shoulder, I'm able to get a flat plane that starts to exist around that and create like a 1 millimeter depth of margin you can see here in the shoulder. And it really, I think this method helps to reduce ditching and ledging. It really helps to create a much smoother 360 marginal transition that you're trying to really achieve here. So again, work counterclockwise, and I think that really can help the feel of your handpiece and really help create a better definition. As I near the final steps of the margin, I will then begin to completely move circumferentially around the tooth just then to make sure that there's no undercuts, and I will really allow that burr to run completely around the tooth with nice control and make that happen. So again, I'm using the burr, the depth of the burr, and I'm using it in a manner that's working against. If the burr's spinning clockwise, I'm moving counterclockwise, so I can really pull into the tooth and really establish fine and even and uniform cutting ability, so effectiveness. So I think that really works nicely. That's a great tip, and I've been doing that now for probably over 15 years, and it works extraordinarily well. And I think once you get the hang of it, It really is something to finesse, and it makes things a lot easier. Rather than doing a little bit at a time, which we call that stitching sometimes together, you tend to get ledging, you tend to get little nicks, and especially if you're doing any kind of digital impressioning or scanning, you really can identify those. So you get a much smoother margin, I think, if you approach this, get everything together, and then really move circumferentially, and I think you'll do a much better marginal definition creation. I want to spend a few minutes on different types of margins. I'd like to say at the outset, the type of restoration and the materials that are going to be fabricated will dictate the type of margin that you're going to need to prepare. So if you have questions about the materials or the restoration, call your lab, call your ceramist, and just have a nice conversation, learn from each other, because it's really important to know that you're on the same page, that you're going to be able to deliver a good quality product to them, that they can in turn create something quality back for you, for your patient. So I think that's a really important element, to get on the same page, understand what they need from you, and I think it just works hand in hand, and it's a much better relationship, and you're going to deliver much better dentistry, long-term dentistry as well. As you can see here, there are two different types of chamfer variations, and again, depending on the type of burr that you choose, some have more of a round end taper, the others more of a moderate chamfer. Again, this is all depending on what type of burr you're going to choose for the chamfer. It will dictate the type of margin. So rely on your burr to create that margin. Really, really important. You'll see me list also too throughout the program several of the numbers of the burrs that I'm using, and if you have any questions on that, I'll be happy to give materials listing at the end as well too. But you can see a prep here that I've done with a moderate chamfer here in the lower right picture. There's two molars on. You'll see the case in just a little bit as well, but that was prepared for zirconia restorations there. The shoulder is the most popular margin right now. It's suitable for all CAD/CAM and ceramic type restorations. A modified shoulder too is one choice of, again, shoulder, or a flat 90-degree shoulder are used the most. When you look at a quick list of ceramics and materials in the markets, in the market today, you've got Emax, CAD, lithium disilicate, you've got Lava Ultimate, nano composite ceramics, you've got Lava zirconium oxide, chairside E4D, and Ceric. You've got Lab Lava, Zircon, others. I mean, the list is continually growing. Again, to be prepared, you've got to select the burr design that will properly create the margin that you need. It's really about having the right arsenal of tools to prepare for what kind of restorations are indicated here. So again, make it simple for yourself. Select the proper burr to make the proper margin. A bevel margin is suitable here for PFMs, porcelain fused to metal, and zirconia restorations as well, as you can see. And I do want to note that this type of margin offers the most maximum retention and resistance form that we have today. So just kind of interesting to note that as well. The last margin I'll talk about is a knife or feather-edged margin, and this is a margin that's suitable for a minimal prep veneer or full metal restorations, as you can see illustrated here. So this is a very detailed, very finely thinned margin that is created with a specific burr, and we'll go into that in just a little bit, and I'll show you which ones I think are very appropriate for this type of margin preparation. So I want to talk a little bit about where it matters most, because a consideration of infection control is really important with the burr inventory, and as diamonds are used and reused, where does the cutting efficiency stop and start? How uniform are my preparations? I mean, these are questions that you ask yourself, and to our naked eye, we really can't necessarily tell how our burrs are performing. We see it more so that they just maybe don't cut, or they're starting to drag a little bit, but the bottom line is burrs are really subjected to a lot of rigors. They have rigors of heat, there's vibration, you've got drag, you've got dehydration, chattering, torque from our handpieces. So what happens is they begin to lose their particles, like I talked about earlier. They start to change shape, they become irregular. And one of the most common issues to be aware of is when the tip of the burr, which is the most critical area that we rely on to form the margin of the preparation, starts to become or go bald. And really this will lead to a misshapen prep, And worse yet, it's going to lead to a very non-defined margin. So my solution for this is I recommend that you use a single-use burr for a single crown prep, or use multi-use diamonds that are specifically made for multi-use, and then you discard them. I think there's no really good way to know how many times we need to use burrs, how many preps they can last, and I know burrs are expensive, but I think if you can do something that really helps to balance the cost and the effectiveness, you are really, really money ahead. The, consideration, like I talked earlier about with inventory and with infection control, you kind of think about the picture here on the left. This practice likes to reuse their burrs, and personally, I don't even know how you can go about that burr block and grab something without with your gloved hand and not infect something or break the. I don't know. It's just not an effective method, and it's really not safe for patients. Here again, there's no way to tell how many times we've used the burr, how much we've cleaned it. Can you even clean a diamond burr? I mean, I think to me, there's just no way to remove tooth debris from a diamond. If you do try to do it, it's very laborious, and I say just save yourself the time and the hassle, your patient safety. I'd rather have my assistants chairside doing treatment rather than trying to clean diamond burrs, honestly, that are going to be very difficult. And I think just quit the frustration. You'll be money ahead, and your hand fatigue will be ahead too, because you're going to have better cutting efficiency. You're going to have a sterile, fresh burr if you choose to go with a single route or the multi-use when you need that. And I think it's just a smarter move. You can see here in the burr block on the right, I've got, my assistants will place out if we're going to do a multi-quadrant dentistry. They're going to go ahead and put a multi-use variety of burrs out there that they know that I use, and that's fresh, easy to go. It's a magnetized block, and they'll load that, easy to grab. They know exactly, and we know exactly what we've used, how we used it, and this will be discarded when we're done with those preparations for that patient. One of my mentors told me early on, always maintain a clean working field. You can do this in several ways, and first, I think it's important to know that you need to use copious amounts of water when you're prepping teeth. Debris removal, along with tooth hydration and burr coolant, is really critical to create excellent preparations. You need to follow that up then with good isolation, with a high-vac suction. You can use different gadgets like the Optigate that you can see here. NeoDries are another great little isolation and little tool. But the bottom line is you really need to keep hydration happening in a clean work field. Keep your preps as clean as you can. Rinse them off. Keep them hydrated. Keep them moist, because it's healthier for the tooth. It also is better for your eyes visually to see what you have, where your margins are, where your preparations are, and really keep the tissues as rinsed off and really remove any residual debris. I think it's just really important. I know it sounds simple, but after all the preps that I do, I will go ahead and take either a 2% chlorhexidine, or I'll take ethylene peroxide, and we scrub the preparations and we cleanse them. And you can see here how nice these preps look. I've gone ahead and just I have one prep. You can see the premolar on the top right that is remaining moist, but that's absolutely how they look when we're completed with them, because now we're ready to go with tissue management, get ready for impression, and we move forward. But we keep things hydrated, keep it clean, keep the field clean. I think you just have a better working environment, and just really sets a nice stage for when you move forward into the impressioning phase, which is challenging enough on its own. So keep your working field clean, use lots of water, and I think high vac suction, keep things really in pristine shape. Let's look at some cases here, and so you can kind of grasp what I'm working through, and I'm sure you're getting the feel of where I'm at, what I'm doing here. But this is a nice case. A 24-year-old patient came in with the need to crown her upper maxillary left central tooth. The treatment plan basically called for removal of this composite that she had. It was very bulky, and again, proper reduction was critical to making sure this case was correct and right, as well as the margin placement. So those are the biggest challenges. So you can see here again, I've listed the guidelines in the bottom right picture. Again, 1.5 to 2 millimeters of incisal reduction. The lingual aspect of most anteriors, again, are critical reduction teetering point, because often with occlusion we don't check that as well as we need to. So again, use your depth cuts and really do those appropriately to really link those lingual aspects and then connect that to have the proper reduction. So you can see here I've just drawn some little dots step by step here. I'm using a modified shoulder, and I'm going to just place that on its side. This is a millimeter in depth, and I'm going to go ahead and just initially incite some depth grooves on the incisal edge. I placed 3 of those, and then I'm going to go ahead and connect those depth grooves. Now I'm using this solo diamond here. This is a one and done diamond. I love these. I think they're extremely efficient. They cut very nicely, cut very cleanly. This is a coarse style solo diamond I'm using here. You can see here now we're going to go ahead and I've leveled off the incisal edge. Next, we're going to move forward here. I'm going to go ahead and break contact, and I just really like how I can use a nice flame-shaped burr. Again, that's coarse. Then I'm going to go ahead and place a matrix on either side, slice through the interproximals, and now I've got incisal and I've got interproximal adjacent tooth structure clear and clean, and I can really start to focus on what the facial aspect and the lingual aspects of this prep look like. So those are the first steps that I like to take towards all my preps. Do the occlusal or incisal reduction, and then go ahead and tackle the interproximal or break the contact. Depth grooves are really important here. And you can see here I'm doing 5 depth grooves on the facial aspect of this tooth. Again, I'm using the modified shoulder. It's a coarse solo diamond. I'm going to go ahead and I position these grooves on the line and angles of the teeth as well as the facial planes. And I think when you place 5 of these, you can get a good aspect of what the emergence profile is as well as the line angles, and it really helps to reduce any type of undercuts as well. It really helps to set your stage for a more uniform reduction. I think that's critical. Next, I'll move to the lingual aspect, and I'll do again the same thing. I'll place depth grooves with the modified shoulder, and again I'll connect those. And now I'm going to use a football that you can see here on the lower left, a solo diamond football. That shape will go ahead and connect and really get that lingual and nice reduction specifically, so I can check again with occlusion, make sure everything's connected, it's smooth, but I've got a good sighting on exactly how much has been reduced conservatively, and I've measured it properly as well. And I'm showing here this model here. I've included this just because I want to remind all of us, if we are doing digital scanning, impression scanning, no matter if you're doing that or you're doing traditional, the need to be precise on margins is really critical, and preparation detail is really critical. And when you start doing more scanning, you can really see from the lab where you need to improve upon. So look at your models that come back. I encourage you to do that, and look at the scans and really see how you can finesse your preparations, because you can really learn a lot from that. The same when you take digital photographs on patients, you really can learn a lot from just capturing that moment, seeing and holding that and toggling that in your hand and getting a good idea of what could be improved upon or what you really did well. So it's good learning tools. Here you can see the final preparation here. This margin was finalized using the modified shoulder like I showed you earlier, and then the prep was smoothed with a generic composite polisher. All of those solo diamonds that you just saw were discarded, and you can see here the final crown as well on the top right. I do want to make a point here. I like to often use composite polishers to finalize, just really at the end point, to really make sure the preparations are very smooth. And again, I've learned that from digital scanning. I think it's a nice touch, and it just helps to keep things rounded, especially for the ceramics. And you can see here the occlusal view looking down on the preparation on the bottom. You can see the lineup of that as well in the reduction. So I like to be conservative, but again, sometimes you can be not conservative enough, or sometimes you're over conservative and you have other issues too. So again, looking at the adjacent teeth, aligning this properly, doing the depth cuts, everything sets yourself up for success when I think you go about it methodically. And I really think once you get into that system, it really becomes a natural unfolding of really more efficient, more retentive preparations. Here's another case here. This is a 52-year-old patient who presented with the need to have his first maxillary molar crown removed. It was an old zirconia crown. It's probably one of the first ones that was ever done, probably, it looks like. And also the second molar crown as well. And this case requires some unique cutting demands in the factor that I had to remove an existing zirconia crown. So I know that many of us are removing these things, or you maybe need to access through with for an endo access. So again, you're going to ask a lot and demand a lot of your burrs to make sure that access is done properly. So very important to use the proper burr selection. So here in this case, what I'm going to be using, because of the cutting demands, I'm going to use a multi-use two-striper diamonds. And these are excellent, excellent diamonds. They're a good choice because they maintain their cutting effectiveness throughout multiple preparations. So in this case here, I'm going to be doing, obviously you can see, 2 preparations. Obviously one is already a crown prep, but I need to remove that zirconia. So I need some really amazing cutting effectiveness to get through that zirconia, because zirconia, we all know, is very, very strong. Another nice thing about these burrs as well, and I'm showing options here, they offer varying shank lengths. So again, this is very useful if you're working on posterior teeth where maybe you have a shorter tooth or shorter access. So you go to a shortcut type burr that's going to allow you to really properly, again, use your burr as a measuring tool and a gauge to properly reduce. And sometimes, maybe if you work in the anterior, sometimes canines, sometimes some centrals, even periodontal involved teeth sometimes require that you have a long shank. So again, I like the idea they offer these in different varying shank lengths. So depending on what your preparations call for, you've got different options now too. So again, these 2 stripers I think are really a win-win. Some more reasons why I back up why I like these 2 striper diamonds. They're my cutting tool of choice for lots of reasons. Not all diamond burrs are created equal, and I've been practicing long enough to really have discovered that. And during the fabrication process, when burrs are made, some have a true bonded process where the plates of the crystals and diamonds are placed and they're plated uniformly onto the matrix. Others are not done into that matter. They're not bonded, and what happens is the diamonds, often the particles technically are more trapped, and they create more inconsistent layers, and the electroplating doesn't really technically allow them to be a more uniform cutting, so they lose their particles easier, and they're not as attached as they should be. So you can see here in the SEM, the magnification on each of these 2 comparisons, there is differences. And I think, again, when you allow yourself to go for the quality and realize I want cutting efficiency and effectiveness, you've got to choose products that are going to offer reasons why scientifically you put them into your practice. And as a clinical researcher, I want things to work in my hands that are supported by the literature and the data. And you can see here some of the things that I found over time too, through a couple different studies, and I'm citing here. Reality in 2012 ranked the 2 stripers 4.4 stars. That's a great ranking out of 5. That tells you it's going to be a win-win. More importantly, you're going to see a CRA factor here with Gordon Christensen is talking completely about how with these diamonds, the way that they can cut and access through different ceramics, they cause less micro fracturing. So that's a really big factor to consider. So with cutting efficiency, choose diamonds that are going to give you the access that you need with without the micro fracturing. 2 stripers an answer to that. I think we all know that we have preparations that we have to sometimes create that go through zirconia. You've got to have something fine. If you can use a fine grit to do that versus a coarse and make it easily happen, that's going to win-win in your hands. So again, proper selection of materials is really, really critical here. Moving forward here, you can see there were caries present in this mesial buccal aspect of the second molar. So I used a slow number 4 round burr to remove the decay. And then I confirmed a solid 2 structure was there with caries dye finder. I placed a pulpal protectant Theracal, and after that, the thing here is, sure, I could have probably gone forward and went and prepped and finalized prep, but I didn't want to do that. I knew there would be undercuts, there would be a lot of undulation in the preparation. I like to have the preparations as smooth as possible and rounded nicely. So I went ahead and I think you always need to take the stance of making everything as ideal as you can. So no matter if you have tooth portions that are missing, they're undercuts, I think in this, these cases, you've got to use the proper buildups or flowable materials in which you can create a more retentive preparation. So again, go back to those very first few slides I talked about between retentive and non-retentive. Here's something that you really don't want to shortcut. You want to make sure that your preps are very retentive. Do that with the proper buildup, and that way you can really deliver, I think, good products for your patients long term. I'm going to go ahead after I placed my, let's see here, I placed my Theracal, I went ahead and did that. Then I'm going to go ahead and I'm going to use a self-etching scrubber, universal bonding agent. I'm going to scrub that in an affected area around the dentin, and there's a little bit of enamel there yet too. For about 20 seconds, I'm going to lightly air that. Thin for about 5 seconds, light cure that for 10 seconds, and then I'm going to use, and what I did here is a CompCore AF, and I place this buildup material on the dentin, and you can see here on the bottom picture how that's looking, how that flows. I really like this buildup material because it doesn't slump. It syringes. It's easy to syringe. You can access things nicely, and most importantly, it cuts very similar to dentin. So it's a very nice buildup replacement material. I went in and light cured this material for 20 seconds and allowed it to stay, and then we're ready to move forward now and finalize these preparations. If burrs really are allowed to heat up a surface in which they come in contact with, they are more prone, like I talked about earlier, to having their diamond particles fall off, and then they lose their effectiveness. So the bottom line is studies show that water spray is an important variable. And as clinicians, we should use as much water as possible without compromising our visibility when we're cutting and to achieve fast cutting. So not only does it water spray cool the tooth, but it helps to also minimize clogging of the burr, as well as it lubricates the cutting process. So remember, always use lots of water when you're cutting. Go back to that need for speed. We all think that we want to do this fast, but again, the compromising, what happens? So with that heat buildup that it can occur on the burr, if you pick a good quality burr, you're going to need to absolutely have quality water spray and a lot of it to really cut effectively and to not harm the tissues, the tooth tissues especially. Now, as you look here, you can see the reduction of the 2 molars. I've got the occlusal reduction. I've been able to verify that, and it's really, again, critical to understand and know those dimensions and how the burrs match. So I placed the molar picture in the guideline-wise in the bottom right again, just to remind us 1.5 to 2 millimeters of reduction needed for these zirconia-style crowns. You can see here now the final crowns are completed here on the top picture. These were done with a chamfer-style margin, and I want to talk a little bit briefly the importance of having on the lower left the provisionals in there as a teacher. And often when we have our temporaries placed, they might be thin, they might have even a hole through them in the occlusal aspect or whatnot or wherever. But bottom line is use your provisionals as a teacher because they're going to help guide you whether you need to reduce some more or you reduced enough. You can see in the bottom right picture that is the final delivery of those crowns here. So again, key elements, you want to keep your lab happy, and you want to make sure that you have the proper amount and the depth reduced. So again, use your provisional as a teacher, and I think that's a really simple trick, but it works all the time. Let's talk a little bit here about aesthetic challenge, and this was a pretty important case here. This patient has had a lot of challenges. These were initially veneers, and so I'm kind of moving into this case with already a dictation of where the margins are going to be at, and this patient has a lot of high aesthetic demands, and we just really need to convert these veneers into full coverage crowns. So this is a really challenging case. Many times we see this. So for multiple preparations, I'm going to choose the two-striper multi-use diamonds. And you can see exactly what I'm using below, how they're listed. These are actually sold in the package like you can see on the left, the bottom left, and everything is identified there nicely. I like the idea that I can open these up. They're sterile. they're single use, or not single use but multi-use. I'm going to discard them after this patient, and I know that I've delivered a quality product for my patient. More importantly, I'm benefiting as the clinician for using a great quality product. And I think that's just so important. I talked earlier about why do I like two-stripers. One of the reasons that I find is they are the fastest brand on the market today in a head-to-head test by CRA. And they cut, they measure these by cutting 1, 2, 3, 4, so on preps, but they were cutting the third prep faster than what some of the first preps were being done. And so again, you're looking at quality, you're looking at consistency. When you're matching head to head, and these come out consistently with different measurements of independent evaluators, I think you really got to consider, why do you want to choose certain things? This is a reason. They cut effectively, they cut efficiently, they cut fast, and they cut with quality. So again, I like that. You can see also I'm introducing here a diamond dressing stone that is also offered by Premier. And frequently when I'm doing multiple preps like this, I'll just take my burr and I'll lay it right into the dressing stone and just help, again, remove any tooth debris. In this case, we're removing the veneers, and we really had to, they were bonded on, and some of these bonded restorations we got to remove and cut off are very difficult. So there's a lot of ceramics, there's tooth debris. You just really need to make sure your burrs are clean and they're performing well, and that's just a nice little gadget to have your assistants put out for you, and just let your burr sink it in there, and it'll help clean the debris, and then you can, again, move forward here. Here you can see the scan of the detail of final impression here. Again, see the clarity of the margins and the sulcus area. The lower picture that I've inserted shows the design of the final crowns that are being made as well. So again, think about the detail, learn from your scans, learn from your impressions, learn from pictures where and what you're doing well, maybe what you need to improve upon. Again, here's the provisionals. As a teacher, you can see the incisal edges here. We've got these. This case we did wax up ahead of time. We kind of knew where we're going to go with this. But more importantly, the lingual reduction was critical to make sure that there was proper occlusion there, proper pronunciation, proper incisal length for specific sounds too. So again, use your provisionals as a teacher for depth reduction as well to see how your preps are going to turn out for later on. And this really helps you set the stage for less reduction down the road, or the last thing you want to do is reduce an opposing tooth or have to go back and re-prep or re-impression. Here you can see the final seat of that case. These were done with EMAX crowns, and the patient was very happy with this. I was too. It turned out it was a nice case, and it was a challenging case, but I think we really were able to deliver with that. The coloration, the aesthetics, I think turned out really nice, and patients are very appreciative when you really work hard for them, and that's a nice way to do that and deliver that for them. I'm going to end here with a final case of veneers. And this was a challenging case as well because, again, existing composites that are very bulky, and the cause here is of the call to order is removing old composite that you get into. Sometimes it's got decay underneath it, it's been leaky. Some of these older restorations, you really can get into Pandora's box sometimes. So again, I want to be able to use burrs that are conservative, that can cut correctly, but more importantly, really can help modify that tooth to being the proper veneer preparation that needs to be. So I'm going to go ahead and move forward and use a flame-shaped Premier, a two-striper again. And I'm using this burr with a medium grit. I like to use medium. I don't use coarse on veneers. I like to use a medium grit for veneers here. I think that slows back the cutting. It's not as aggressive in cutting tooth removal. So I'm going to use a medium grit. So that's a little trick you can use as well. You won't over reduce with that type of selection of burr. And that burr right there can pretty well do everything I ask for it to do of all these 4 preparations. So I don't have to switch back and forth with many burrs. I like to minimize my inventory, and with good burrs, I think, and with the proper grit selections, I think that you can achieve that. At this point in time, once the veneers are prepped, I'm going to go ahead and polish those as well, like I talked about with just a generic composite polisher. It works very nicely, and then we're ready to take impressions. Here you can see the final net. I've included the top picture just for comparison photo value of what we had started with, where the provisionals were, again, using them as a teacher, and you can see the final case photograph on the very bottom And you can see just how nice that turned out, and that was a really neat case. Turned out well, turned out healthy for the tissues. Again, the patient was pretty thrilled with that as well. So, to recap, I think that when you use burr dimensions to your advantage, by doing so, you will absolutely become more efficient in your prepping. And there will be fewer times that you really will have to change out your burrs. I think that's a really big takeaway here. The second secret I find is that you develop a methodical reduction approach. Move around the tooth in a constant direction. Back and forth motions, like I talked about, often lead to stepping or ledging, so especially with margins. So hone it. Learn that methodical reduction. Start with incisal or occlusal, smooth that, reestablish that, break your contacts, facial and lingual reduction, margin creation. I think step by step, if you take that on, I think you're going to really develop kinder and easier preps. Kinder to your hands and kinder to your eyes as well, too. I think next then, third wise secret, you need to select the right burr for the job. And I think the burr has to really be the one that has the ability to not only measure, but also to cut as well. And, it's interesting, you need to select the right burr, whether it's a multi-use burr for, say, quadrant preparations, or if you're going to use a single-use burr for a single crown prep. We tend to get, and then you discard these. That's what I'm going to tell you. I really recommend that. Somehow as clinicians, we trip over dollars to pick up pennies. And, in dentistry, time is money. And in this case, it's also an infection control issue, and we're jeopardizing patient safety. So select the right burr, know its limitations, know when the effectiveness is stopped, and move on. And I think you just are going to deliver a much better product for your patient. And they're obviously certainly going to be thrilled with what they know you're doing, which is completely dedicated for them. And I think that's the right approach. Fourthly, I think you need to use copious amounts of water. Studies show that your cutting effectiveness will improve. I think that's just a home run for that as well. And finally, use your provisional or your temporary as a teacher. Make sure that you've got that proper thickness. Because if the occlusal is going to be thin, your final restoration is going to be thin. So try to avoid that if you can. Use your provisional as a teacher. So important. Basic ideas, but sometimes they're just so critical to step back a little bit, and we don't want to lose sight of all these little basics. Put them together and build your toolkit and really approach your patients. I think you're going to offer much, much better care and really reduce your frustration as well, too. So with all that information, I'd like to entertain some questions now. And I've got a bunch of questions here. First one here is, what is the depth of your margins? And when you saw the slides earlier about whether it was an anterior or posterior, a molar, for example, most of, I would say 90% of, if you're going to do a shoulder preparation, I think you need to have a 1 millimeter. Sometimes it might even be 1.5 millimeters almost, but you need to have 1 millimeter for sure depth on those margins. Very, very important to do that, especially for the ceramics today, especially for CAD/CAM. That depth is needed to really create the strength within and provide for that strength for that final restoration. Another good question, how do you get smooth preps? So what I like to do, again, I mentioned earlier, I start often with traditional preparations. I use a coarse style grit for my burrs, and once I get the preparation finalized, I will go ahead and then use a ceramic polisher. Sometimes I might even pick up maybe a fine grit burr that I might need to smooth out something, especially if I've done a buildup, but I want to make sure that everything is very blended. And the last thing I want to do is use a like I said, a generic composite polisher. I think those work very nicely, and they really help to create a nice ability to, whether you're going to scan or whether you're going to flow impression material over that, I think you just get an improved capture with everything that's nicely smooth as well as rounded too. So again, another critical element for these ceramic materials. I got some more questions here. What is your approach to short clinical crowns for second molars? Great question. I think that you have to weigh out where your retention is, your height again and retention. I think sometimes you might need the requirement of having crown lengthening. If that's not the case, then I think you need to look at how are you going to place that final restoration, and are you going to be bonding that and using some kind of adhesive cementation protocol? I think that's where that has to be at, and I know that you need to think about that with the end in mind when you're prepping these teeth. When you start to get in that non-retentive gray area per se, you really need to make sure that you absolutely are certain that you know how you're going to place that restoration. You know, not everything we do here is ideal, and not everything that's presented to us is ideal, and we have to try to get it to as ideal as possible. So again, don't I can't say that the materials we have today can't make up for sloppy dentistry. So we've got to come to the table and really try to do the very best that we can, and then again use the best products we have to help us deliver that product for our patient. It's interesting. I love this comment. In an era of all ceramic crowns, is a subgingival margin really necessary, or equigingival? I love that comment because it's really important, I think, that with ceramics now, and depending on what the aesthetics call for, where the restoration is in the mouth, I think that you have to really, again, consider what the subgingival margin. I think that equigingival margins are very much in play today. I think obviously supergingival margins, ideally for cleansability, are great, but equigingival margins really work very nicely and work very well. I think with ceramics, aesthetics, again, you need to talk this over with your lab technician. You need to talk it over with the patient, consider where the tooth, the preparation is being at within the mouth, and really make your choices from there and where you're going to place that margin at. I've got some good more questions here. Let's see. Are you bonding or cementing? So I'm going to go back to this a little bit. I think I don't want to do too many crosshairs here, but when you're looking at preps that start to push that limit, that the height is shorter, it's a non-retentive prep, I think you've got to look at doing some type of adhesive cementation. You're bonding that crown in place. I think if you don't do that, you're really going to fall into a problem where you're going to have that crown come off. All right, let's see. I got a couple more questions here. Got a couple more minutes here. What do you use to place an interproximal? Do you use separators, or do you do any type of wedging? No, I do not, but I often, like I shared earlier, I'll use a wedge guard, or I'll use just a plain matrix band. Sometimes I'll use just some individual foil that just will help me protect that adjacent surface so that I know I don't scuff it or have any ability to nick it. And it just really helps me, again, move forward and save any hassle of backing up and trying to polish or adjust or anything. Another good question, how do I measure my preps? So I'm using, I like to use the round diamond burr that's 1 millimeter in depth, and that's going to be all my measuring tool as well as cutting. I'm going to go ahead and sink that into the occlusal like I showed earlier with the one of the first slides, where I've got 3 reduction little sinkholes, for lack of a better term, that are 1 millimeter in depth. And I know from there then I can start to smooth everything out. I can take a shoulder burr and I can go ahead and lay that out laterally and start to integrate that and then reestablish that occlusal table, and I know that I'm going to have the proper depth on that of reduction. Another good question. When you're measuring your preps, or do you always use a guide, a gauge? Yeah, I mean, often I do. I mean, obviously, if I'm measuring and using my burrs as a measuring tool and gauge, I don't have to. But sometimes, especially on second molars, I find those are really difficult, and they're hard to sight correctly. So often I will use measuring gauges on those second molars. A lot of times I'll use measuring gauges on the anterior teeth as well, just because I just need to make sure that that proper reduction, especially for the lingual thickness of that the final restoration, is adequate. And sometimes we can really fall short on that too. So lingual of the aspects of those anterior teeth can really be tough. So make sure you absolutely for sure measure and use different gauges. And you know, there's different things on the market today. Whatever works well in your hands, that's what I suggest that you do as well. So we kind of come to the end here. What I'd like to recommend, and want to let you know that if you have any desire to learn of the materials that I'm using here and the different format of what I've shown you here, I'd be more than happy to share that with you. You can email me at trost, T-R-O-S-T, at htc.net. And I'd be happy to get that. I'll probably work on that and get that to you next week for sure. And I'd like to recommend that you stay on the program and follow the queue for your continuing education credit. Thank you for your time, and I hope that all of you have a great rest of the day. Thank you so much.